Usually, people start to actually worry about their health when they are in their 40s, but nowadays, loads of people are interested in living till they're 200 years old. So, what are the tools today that we have that can help predict our cardiovascular disease risk?
Well, first off, vascular health is intimately tied to, health span and longevity. As you mentioned, 1 in 4 people die of heart disease. So every 40 seconds or so, somebody's dying of a heart attack. So if you don't take care of your vascular system, you're not going to make it to 100, 120 or beyond. And so you have to actually test the arteries and look at them because you can't just look at somebody from the outside and have any concept of what's really going on in their arteries at any point in time. And so there's serial, non-invasive tests that you can look at, and then there's a whole host of biomarkers that you can get an idea if the arteries are going to be healthy or not.
So you were talking about endothelial dysfunction. The primordial question is that there are different pathways, right? But how does cholesterol actually enter into your blood vessel? How does it actually break through the walls? And then there's of course a big debate about what starts the irritation, or what's the initial injury or insult to the vessel wall that leads to cholesterol getting deposited into your blood. And then there's a whole process of oxidation that can lead to much more significant heart disease. And as you mentioned, that you can be as early as in your early childhood, before even you're 10 years old, and you have fatty streaks in your blood vessels. What is the mechanism by which cholesterol actually starts to go into your walls?
It's classically thought that it's, the endothelium becomes dysfunctional for whatever reason. There's lower nitric oxide availability. The lipoproteins are then going to adhere to the endothelial lining, get retained, and then become part of the intima, where then the monocytes, part of the immune system comes in and investigate, hey, what's coming in here? And then the monocytes start to gobble up the lipoproteins, and then the plaques start developing. But even if you have a healthy endothelium and glycocalyx, it is still possible for the ApoB containing particles to get into the lining of the walls. It's just less likely.
When we talk about cardiac tests, we look at the EKG, then stress testing, cardiac catheterization, coronary calcium scoring, then the Clearly test, then blood tests that we can all haggle about which works, which does not work, and which is the first, which is the test that can be is the most predictive of your cardiovascular disease risk. What is the first test anybody is looking to assess their cardiovascular risk? What would that be?
It's going to be somewhat dependent on what their age is. I mean, if they're over the age of 40, I usually recommend they start with a CT coronary calcium scan. You're not supposed to have calcium in your arteries, so your score should be 0 forever. But if you live long enough, often your calcium score test is going to pop positive. You just want it to be later in life, not in your 30s or 40s. So I usually start with that test for people who are a little bit later. But you said earlier, vascular disease starts when you're, born essentially. The clock is ticking. So if you develop endothelial dysfunction, you're well on your way to developing atherosclerosis. There's definitely studies, in autopsy patients of people who got killed in wars, who were 18 to 22 years old, died traumatically, but they already had fatty streaks in their blood vessels. They weren't going to die anytime soon from a myocardial infarction, but left unchecked in the 40s and 50s, they probably start showing up. And as mentioned, I was an invasive cardiologist for many years, seen lots of heart attacks. And oftentimes that's the first time somebody has any signs or symptoms that they have heart disease is they're actually having a heart attack. And so, we're just waiting until you have an EKG or a positive stress test or cath. You're really late to the game and you're hoping they can save your life at that point. That's why I got interested, many years ago, like how do you actually get to the root cause of it? And it really starts with endothelial dysfunction.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umar Khan. Looking forward to seeing you again. Thank you.